COVID-19 update. Community Action Now is here to provide those in underserved communities with resources to combat poverty. And in addition, Community Action Now offers advocacy programs. It assists with disaster management, education, and outreach services. Since 2014, we have assisted the Virgin Islands and the Eastern Metro Atlanta, Georgia area with resources to combat poverty, to include such as advocacy, disaster management, education, and outreach services, of which disaster management is part of our process here this afternoon on this live in response to the COVID-19 outbreak pandemic. Community Action Now is providing a series of COVID-19 updates with informations and sessions to the community in partnership with the Philadelphia College of Osteopathic Medicine in Georgia. And we have the Infectious Diseases Expert, Dr. Valerie Cadet, that will be joining us shortly on this live. And she works for the Philadelphia College of Osteopathic Medicine. And she's no stranger to the Community Action Now group. They have assisted to support the Virgin Islands medical evacuees that went to Atlanta following the responses from Hurricane Irma and Hurricane Maria. And she's also a board advisor to Community Action Now. So
can you hear me?
I can, but I can't see you as yet. So I'm just waiting for you to get connected.
I don't know what happened. Our connection was perfectly fine. And now I can see myself. Everything looks perfect, but I recognize that you can't see me. I can hear you perfectly fine. And I can see myself. So I'm not sure what happened there.
I saw something happen just now, but I think Miss Walker is working on trying to get us connected again.
Okay. In the meantime, thank you so much for having me. As you mentioned, I'm with the Philadelphia College of Osteopathic Medicine, or for short, we call it PCOM Georgia. And I am specifically in the Metro Atlanta area. And I have a doctorate in infectious diseases. I've worked on viruses, vaccines, bioterrorism, pathogens, and a variety of other things in that realm. And so I currently teach microbiology and immunology and all types of subjects related to this right here. I don't know what happened to my video. It was perfect literally right before we went live.
Yeah. There is that webcam insignia icon that's on the upper left-hand side of the screen. You could try clicking on it to see if that would.
It shows that it's on. I can actually see myself in the feed. Ms. Walker, if you can you see if you can update my camera privileges, perhaps? I'm not sure.
Well, for most part, perhaps in the interim, I could maybe ask you a few questions while we try to establish that connection. I don't know if you heard me just now. Hello? Hello?
Oh,
there you are.
Yeah.
There you are. There you are. Okay, good. Oh, you disappeared again. Okay, give me 1 second.
Okay. Am I back?
Yes, sorry. I apologize.
No worries. Can you see me?
I can, yes, and I can hear you loud and clear.
Perfect. I am so sorry for the technical difficulties. I don't know
That's
what
okay.
happened.
Things happen, and we are happy to have you.
Thank you.
Yes. So you did introduce yourself a bit earlier, and I was hoping if you could answer a few questions. Here in the Virgin Islands, we're experiencing, I suppose, the beginning of the changes that we're going to have to get accustomed to moving forward. And I think most people, from what I've seen or understand, are adapting quite well. But I'm not sure if this is just going to be day to day moving forward, or how bad it's going to get, how much change. I mean, I'm sure since you're in the mainland in Atlanta, Georgia, you probably have seen the changes as they've progressed because of the outbreak. Could you kind of give us a little update on that, if you don't mind?
Sure. Sure. It's something that I can honestly say is difficult to wrap your head around. So the changes are rapid, very, very quickly coming, and they are definitely on a day to day, but sometimes within the same day, we're seeing major change and major shifting from your local government, what they're suggesting or saying we need to do. That can even shift within the day. So yes, as you guys mentioned, you're definitely behind us, um, and hopefully can stay that way, and hopefully learn from what we're doing on the mainland, and what we're doing here varies kind of drastically from place to place as well, so far, and hopefully we're learning from Italy and Iran and South Korea and China, of course. That's so much further ahead of us. Yesterday was the first day that China experienced 24 hours without a locally acquired case. So that's a huge milestone.
Yeah.
Um, what we know is that we haven't even peaked. The peak is coming, and then you guys are going to be behind us. So right now, I'm in the Metro Atlanta area. I'm in Gwinnett County, and so, Gwinnett County has its own, rules and regulations. What I've seen, and that's going to vary too. What I've seen locally here is, a variety of the different cities are closing some of their parks, but not all of them are yet. They're suggesting outside activity, but it's solitary activity, with just you and the members of your individual household. But otherwise, you shouldn't be outside. They're suggesting in terms of playing basketball with others, or throwing the ball around, or kids on the playground, things like that. That shouldn't be really what's going on right now. Although again, not all municipalities are on the same page. For instance, the city of Atlanta went live with having shut down the bars, restaurants, and other aspects to sit down business. A lot of areas, is I'm not sure if this has already happened on St. Thomas, or in the islands, but a lot of fast food chains and restaurants have shut down their dining rooms. So some restaurants and places are closed completely, while others are allowing for takeout or delivery. So everyday life is definitely different. Just
Mhm.
earlier today, just to give you an update from, some late news, is Governor Cuomo in New York just announced that, they're going to be they want all non-essential workplaces closed. And that is a move that follows suit from what has just happened in the state of California, you know. So if we look at it in terms of actual population, so far in the United States, that means 1 out of every 5 people, just looking at New York and California, are actually in a state of being sequestered and being asked to limit their movements.
Understood. And to chime in on some of the things that you've experienced on that side, our governor here, Albert Bryant Jr., he had a press conference yesterday, and he also spoke on some of those issues as well. And he also had non-essential government employees working from home or either off duty for the next 2 weeks as a way to try to curb the spread, if possible. And I think that a lot of the people here need to hear from someone like you because you're a specialist in this area. And I have a question, dealing with everyday life. Like, for instance, can you pick up the virus from handling things like cash or postal mail or even pumping gas at the gas station? This is something that I'd like to know.
That's a great question. And, the quick answer is yes, potentially you can. So to elaborate on that, this virus is one that we know can linger on surfaces for anywhere from a couple of hours to days. It's still so new, we don't have definitive, answers to say on this surface it will last, exclusively X amount of days, but we know it can last for up to days. And so recommendations have been to move cashless. If you can just use a card to pay, then use a card as opposed to cash. When you do have to handle cash, of course, use hand sanitizer that is based, with alcohol, at least 60% alcohol. Clean everything down. Even if you're using a card, if you have to hand that card over to somebody and they have to hand it back, if you can clean it beforehand, that would be definitely appropriate. When it comes to the mail, there has been a suggestion that, because paper and other items can hold on to the virus for, at minimum of a few hours, and depending on the surface could be longer, that is a potential for spread. Still the CDC and health departments are saying, however, that the greatest way of spreading is actually through person-to-person spread. But I mean, yeah, all of these items are potential areas, so the recommendation, because how do you carry on? Well, that recommendation is to absolutely be washing your hands first and foremost. Don't freak out if you can't find the hand sanitizer, because soap and water works. The way this virus works, the soap actually can disrupt the outer layer of the virus and inactivate it. So you literally just need to follow the advice and wash your hands frequently, particularly prior to preparing food or eating. Particularly, don't touch your face, your eyes, your nose, your mouth, because this is how, if it's on your hands, you can transmit it to yourself and then get sick. Yeah.
And I've not washed my hands this much since I was a child, I'll be honest with you.
Yes, exactly. When your mother was telling you to do it.
Every 15 minutes or something. Every time I touch something, I'm just washing my hands. And I got to program myself, reevaluate my whole lifestyle.
That's what I was going to say. It's a matter of reevaluating everything, because potentially every surface that's touched can have the virus on it. So, that's why the recommendation also is to clean. Just clean a lot more. Doorknobs, your phone. Everybody forgets the phone, but clean your phone. Clean, when I get out of the car, I do have some disinfecting wipe. And when I get out of the car, the last thing I do is wipe down everything in the car, just in case I did touch something and brought it back into my car. When I come back to my car, it's clean. Although, to be honest, I'm really not going any place anymore. I expect to not go anywhere except for the grocery store when absolutely necessary. So for you guys, where you guys are, you're behind us. We started out with a 2-week, closure, which then expanded longer and longer. And for many, places, it's a lot longer now. And so you guys are at the 2-week phase. So you should be probably going out, and you're in the prevention mode right now. They're trying to stop the spread. But you as an individual, every person as an individual has to be responsible. You should go to the store, go ahead and do not hoard, because that's unnecessary. But go ahead and get some items in your home market every day, so that you don't have to, if you or someone in your household gets sick, you don't have to run straight out, because you want to minimize your movements. That's really where I would expect you guys are going. You're really just following suit, because we followed suit in every place, really in the world. And we're looking at, the latest number I saw is 141 countries at this point Whereas just a couple months ago, this was only in China, one country. Now we're looking at 141 countries. It's inevitable that your 3 cases in the U.S. Virgin Islands are going to expand in numbers. So people should really slow down their movements drastically and prepare to just be at home.
Understood. So another question. So actually, it's sort of like a 2-tier question, but let me just start off with, when should an individual seek medical advice, in your opinion?
So, well, in this case, this is directly from the CDC and the health department's guidance. So at this point, when you have symptoms, well, there's a few, it's sort of twofold actually in terms of an answer. So let's say individually you have symptoms such as, a fever, a cough, shortness of breath. And we're talking, actually not a terribly high fever. It could be 99.7, it could be 100.4. These are signs, of this particular virus. Now, those signs are also symptoms of, other viruses like flu. Flu is actually still circulating in other places, in some places, pretty widely. But these are symptoms that are definitely connected to this virus. So if you experience a fever and or cough or shortness of breath, then it's time perhaps to call your physician, particularly if you're considered one of the vulnerable individuals. So a vulnerable individual is somebody who is older. So we're talking 65 or older, is somebody who has specific medical conditions, things like heart disease, hypertension, diabetes, lung disease. And, I want to take a minute to talk about lung disease because I keep hearing people say, well, I just have asthma. Well, you know what? I actually just have asthma. I know my asthma is well controlled. However, that is considered lung disease, and that is something that people should take seriously because having asthma predisposes you to having severe complications of this disease. And that particular disease is something that I know is fairly widespread, and so much so that people think it's kind of innocent. But in fact, those are the things that can put you at high risk for complications. So when do you call the doctor? When you start to experience symptoms. So from there, you're going to call your doctor or, an urgent care or the ER. Don't go. They don't want you to go and potentially expose other people. For most people, and the estimate is 80% of individuals who actually get infected, you're going to recover just fine. You can recover at home. You would take Tylenol to help manage your fever. Excuse me, unless your physician tells you otherwise. And then regular medicines to help manage, whatever those other symptoms you're experiencing. Outside of that, there are some emergency signs that I'd like to share, if possible, with you. And those emergency symptoms that you would want to look at would be having shortness of breath, having chest pain, having bluish lips. So these are some of the symptoms that if you start to experience, so if you go from, I feel okay, or maybe not so okay, I'm sick, but I'm not horrible, to all of a sudden experiencing those symptoms, the recommendation is to immediately go ahead. They call it an emergency warning sign. So go ahead and contact the hospital and get to the ER, but you want to call ahead to do so. And I want to mention that actually on the CDC's website, they have a coronavirus symptom checker. So you can actually go to the CDC's website, to the coronavirus page, and look at the symptom checker and start to see, if some of your symptoms match and what to do from there.
And thank you so much for that answer. Now, the other part of it is, what if you have a family member, or if it could be even a child, that their immune system is compromised for whatever reason, and they have a lower immune system than the average adult or even child? What should they do? What are some of the precautions or things that they should actually do?
So those people definitely fall into this category that we're talking about, vulnerable. So even if you're not the person who is severely immunocompromised, but your household member is, you need to behave as such. So they really need to be in the house. I call it being in the bubble. And that person really could just be somebody who's elderly with a pre-existing, complicating condition. Actually, it doesn't even have to be severely immunocompromised. But in this case, you and that person plus any of their household contacts need to be extremely careful. The individual needs to remain in the house. The other individuals need to really be enhanced in terms of limiting their own movements and protecting themselves from getting infected, because if they are, they're going to potentially give it to their household contact, and that is something that is not okay, because they are potentially going to be at risk for severe complications. And so, I guess when you look at it, you've got this population of people that are considered vulnerable. So all of those people I listed earlier, as well as, somebody, what about somebody who's going through cancer treatment? What about somebody who's HIV infected? If you're very well managed in your HIV disease, then, you're okay with a, solid immune system. But if, as you go along in your disease, your immune system, of course, is not as capable of handling, the onslaught of other things, everything coming your way. So everybody around you needs to help protect you at this point. So this non-vulnerable population, our young people, and everybody who's considered healthy, actually needs to not be gathering, in groups, large or small. You really don't need to be. If you can work from home because you're considered non-essential in terms of your workplace or, what you actually do, then you need to do that. And maintaining that social distance of 6 feet is really, really important. I call it a crowdsourcing experiment, the largest of anything I really could ever have imagined, larger than that, because all of us have to be responsible to protect everybody that needs to be in the bubble.
Yeah, and I somehow feel that there's a population of people that are negligent to the situation, and they're not taking it seriously, and I guess they won't, perhaps, unless it happens to them. So, I think that it's very important that we, like what we're doing right now, to try to reach out to the masses and let them know how severe this is, how important it is to protect yourself and protect others around you. And I do appreciate you as well, Dr. Cadet. For those of you who are listening in right now, Dr. Cadet is a doctor at the Philadelphia College of Osteopathic Medicine in Georgia, known as what? PCOM?
PCOM Georgia, PCOM Georgia, yeah.
PCOM. And I think that it's important that here in the Virgin Islands that we do our best. I mean, I guess because we're an island, we're sort of already quarantined in a sense. But we do have flights coming in still. Personally, I feel like we should just close out the port. Honestly, just close the flights and just try to protect ourselves as best as possible. But I'm not in any position to make that call. But I hope that whatever we do it for the best interest of our people. But we do have people on the outside. Tim Duncan just joined in with Silver Airlines to help get college students back home, because a lot of colleges have shut down and they're not offering any courses or classes right now. So he's trying to assist, and he's a Virgin Islander as well, to try to get them back home in this time. But if I might ask you, in reference to the kits, I'm not sure if you're familiar or not, but the pen kits and so forth. Do you know
which kits? Did you say the testing kits? Is that what you're referring to?
Yeah, the COVID-19 testing kits.
Yes.
Have you ever seen one or used one or anything like that?
I have not actually seen one or used one. I'm a little familiar, and at this point we have several different test kits out there. I'm a little familiar with the concept behind, what they're doing in terms of testing, and I can elaborate on that. So
Okay.
what we're looking at,
because I'm on a, and I just want.
Yes. So what we're looking at is that, so this is a virus, and just like all of our cells have DNA, viruses have either DNA or something called RNA, which is similar. And RNA is what this virus has. And so what we can actually do is test somebody's swabs. So this is a respiratory virus. And so we're going to actually test nasopharyngeal swab. So a swab from your nose, if to see whether or not there's actual RNA from the virus in those secretions that are going to come out of your nose. Because if you were infected, it should be present. And so these tests are going to actually isolate, the RNA from the swabs that are taken of your nose, and then they're going to determine whether or not that RNA that's in there is actually RNA from this virus. And that's going to be what tells you whether or not you are positive or negative. So the thing about the testing is, the government has expanded the ability of various labs, private labs, and labs that people would have heard about, like for instance, LabCorp and other places, to be able to do some of this testing as well. So there's a variety of different ones. So they probably work in a similar way. Right now, and I'm not sure where you guys are on the island specifically. I know in the United States, and I know you're one of our territories, so I would assume that this extends to you all as well, that there may not be a huge number of tests available. And so our Surgeon General has recommended that really everybody behave as though you're infected, regardless of tests. Tests at this point, because of the shortage, are limited to testing our healthcare workers. We want to test the people on the front line to make sure that they are safe if they've had an exposure, or if they're exhibiting symptoms, to isolate them and protect patients and others around them. Anybody who's caring for the elderly, or somebody who has chronic and underlying health conditions that's exhibiting symptoms, people who are working in long-term care facilities, we would want to test them if they're exhibiting symptoms. And then, of course, the elderly or individuals with chronic underlying health conditions. So the vast majority of people who get sick are actually not going to need a test just because they're sick. What they need to do, though, is check in with the physicians, the hospitals, wherever you get your health care. Let them know that you're sick, these are your symptoms, and then they'll determine, based on any other pre-existing conditions you may have or what your current symptoms are, whether or not you need to come in for advanced treatment.
Okay, thank you. And COVID-19, why is it so aggressive? I've seen the flu, I've seen different diseases, but this one is just so aggressive. I just don't understand why it's so infectious. And as an expert in infectious diseases, what's your take on that?
So this particular virus has what we call an R naught of 2.2. And R naught is an epidemiological term, which really is going to refer to how infectious something actually is. So I forgot the exact R naught for flu, but it's like 1.12, something like that. It's lower. And so what that means ultimately is, when somebody is infected with the flu, you're going to give it to 1 point, whatever that extra number is, right? People.
Yeah.
Versus when somebody is infected with this particular virus, the studies have shown that the R naught is around 2.2. So for every individual that's infected, you're going to infect on average 2.2 people. And those 2.2 are going to infect 2.2 more. And that number grows exponentially. The other thing about it, and there's several things, but one additional thing is that you can be infected with this virus for anywhere from 2 days to 14 days before you have symptoms. So you're walking around, you have no idea you're infected, you feel fine, and you're spreading the infection. So people who have no symptoms are absolutely spreading the infection. And in fact, China just released some data that showed that they estimated that 4 out of every 5 people that actually got infected in China got infected from somebody who did not know that they were already infected. So it's our turn to really learn from that. So China didn't have a chance to learn because it was brand new, right? And so it's going to rip through a population. So this goes back to your question. When a virus or a bacteria, any infectious disease is being seen for the first time in a community, it has the ability to run through that population because nobody is already immune to it. So, I've seen things online and people say, well, I know I'm immune. No, you're not. You're not immune to it because your body has never seen this virus. So that means this virus has the ability for every person being infected to infect 2.2 people, and potentially anybody they run into has that ability to get infected. versus with flu, a lot of people have been vaccinated, right? So that's like a firewall right there stopping, the infection. Plus, it's less infectious overall, less contagious overall. So does that make sense?
Yes, it does. So question, and you mentioned, you referred to individuals that took the flu vaccine. Do individuals that took the flu vaccine have a higher probability of getting COVID-19?
No. So there's no connection.
No.
These two viruses are completely separate, completely different. Their commonality is that they both have RNA in them in terms of their genetic material, but it's different RNA. So the flu vaccine is very protective, and if flu
I
is
like to think
circulating
of
in
it
your...
as like I
Sorry, I think we have
apologize.
a slight
I was
delay.
saying that to me, COVID-19, a slight delay, yeah. But COVID-19 to me is like the flu on steroids or something, because it's like almost 10 times worse, or even worse than that. That's the way I see it or
So
perceive it.
yeah, symptom-wise, it's actually not. That's the funny thing, because if you get the flu, you're going to feel pretty down and out. You're going to have chills. You're going to have a fever. You're going to have that runny nose. You might have a cough, and you're going to feel that way for about a week. And you're going to have some of these same symptoms with COVID-19. Most people that get infected with the flu are actually going to be symptomatic, and you're going to be knocked out for a week. That's what I call it, after having experienced the flu. But why it seems like COVID-19 is so much more severe is because it's more contagious, because you're walking around with it and not knowing it for longer. With flu, you're going to start feeling bad in about a day. And, within 2 days, it's the flu. It happens pretty rapidly, so it overall seems like it's better. And then overall, we have a lot of people that get infected with the flu, but it's not happening all at once, through an entire population in these high numbers, because of the fact that it's less contagious and we have more people vaccinated. But symptoms wise, a lot of people, I think when you're watching the news, a lot of the news stories are failing to remind people that 80% of individuals who get infected with this are going to recover just fine. Period. And a lot of people have mild, either no symptoms at all, or mild symptoms, or, some people I know actually right now are sick with COVID-19 disease, and they feel kind of bad. Their body hurts a little bit. Some people have, fever on and off, and there's a variety of different symptoms, but it's not all, overall it's manageable, and then they're going to get better.
Okay. But from the research that I've done, it works its way down to your throat, and it hibernates there for a while. Then it works its way down into your lungs, and once it gets to your lungs, that's where it does the most damage. Could you kind of elaborate on that whole process for those who are listening?
Sure. So yeah, and you described it short and simple. That's right. So it's a virus that is going to cause respiratory disease. So you've got mucous membranes in your eyes, you've got your nose, you've got your mouth. And so if this virus gets into your mucous membranes through, touching or inhaling somebody else's infected air that they're breathing out, or they've sneezed or something, then the virus actually is going to be able to penetrate into your mucous membranes. It's going to work its way down. So that's, if it went in your nose or even your mouth or eyes, it can work its way down, where generally speaking, you're going to have what we call an upper respiratory infection, right? For most people, those are the people who are having more mild symptoms. And in that case, the virus is getting into those cells of your upper airway, and they're going to replicate. And so one virus particle goes in, you can have, thousands potentially coming out of every cell. And then they can go on to infect neighboring cells. So as you mentioned, it's when that virus continues to travel down your airways and actually make its way into your lungs, that about 20% of people are experiencing those severe complications. And so, this is why, for instance, if you had lung disease, let's say, your lungs are already compromised to some extent. And by the way, I did not mention smokers earlier, but smokers, whether you have a diagnosed asthma or COPD or something else, you are at higher risk because the smoking has been known to damage, airways. And so once this virus makes its way down to your already vulnerable tissues in your lungs, then now it can replicate to such higher levels and it's
Mhm.
killing off your cells. So when your cells themselves within are dying and you're having in some cases, a really bad immune response in there, an overreaction of your immune response, you now are, in a danger zone.
Wow. Thank you so much. And I guess I'd like to just ask you one more question because we're approaching our 40-minute time, as we were indicated by community action now. But I wanted to ask one last question. After that, I would like you to just wrap up for the listening and viewing audience. And the last question is basically, how do we all work together? I mean, I think you've been kind of explaining that piece by piece throughout your whole presentation, but how do we work together to protect ourselves? And for those of you who are listening now, this is Dr. Valerie Cadet from PCOM in Georgia, who has taken out her time today, which we do appreciate, to help us to learn more about the COVID-19 disease. So that last question is, how do we try to work together so that we can all protect each other moving forward?
Well, we work together by listening to the, county, local, city, state, federal authorities. We really, really all need to be doing the same thing. So, I look at pockets of people in this community, you haven't been restricted in your community, while the very next community, let's say county-wise, maybe here, um, has been restricted in movement. Well, if I've been restricted in movement in Gwinnett, for instance, but I can just drive down the street to Atlanta, Fulton County, for instance, then I am going there. I'm potentially exposing myself to lots of people, to infection, and then coming home and bringing it back to my community. So that defeats the purpose. But if all communities are essentially doing the same thing in terms of the guidance, following the guidance of, the health authorities, then we're all going to be limiting our movement. And so as individuals, I guess what can you do now is really pay attention and take it seriously, because it is serious. Look at the numbers worldwide and look at the numbers, how fast they're growing in the United States. And remember that so many people are not showing symptoms already, but they are infected. So our numbers are going to continue to change. So ultimately, need to listen to the authorities and understand that it is moving quickly and everyday life looks different and it's going to look different tomorrow. Some people have been likening it to 9/11. And so if you remember before 9/11, there were all these freedoms that we had. We could move around, we could just do so many different things. Post 9/11, there was the immediate shutdown, which we needed. And then over time, all these new rules and regulations continue to change, so that we didn't have this type of situation again. And, honestly, I get that. I understand that analogy because it is so different today than it was before, and that's going to continue to change. So take it seriously.
Yeah.
If
Agreed. Thank you.
if I could say one more thing, I wanted to kind of address the young people. And by young people, I'm talking about not just the spring breakers. So data has just been released by the CDC, and analysis of a lot of other countries that are showing that 40% of the hospitalizations are in people 20 years old to 56 years old. Before this data, and that's based on worldwide data, before that data became available, the message was that young people were basically not vulnerable to this disease. And what we're seeing in 20 years old and up, your potential for hospitalization is definitely increased, higher than what had been thought before. And then a small study of over 4,000 United States patients that were actually diagnosed with COVID-19 show that 20% of them actually died between the ages of 20 to 64 years old. And then out of the
Wow.
people 20 to 44 years old, we're looking at 20% being hospitalized. So that's 1 in every 5 people between the ages of 20 and 44 being hospitalized. And then 1 in out of every 5 people between the ages of 20 and 64 in the United States dying that have been diagnosed. Think about those numbers and look around you and say, do I want to be in that? Do I want my mom to be in that just because I'm young? You know, and I'm invulnerable, or my grandmother? You know, so it's as we learn more information, we see that it's a lot more serious than, you know, we were thinking initially.
Yeah. And young people need to understand that maybe you might have a lower probability, or at least you thought so until the data came out, but you you were a carrier as well, or you can be a carrier if you're infected. So you also have to realize that and protect those around you. That's the mentality. You have to reevaluate your whole entire life. You have to look at life in a different scope after COVID-19, because moving forward, it's never going to be the same. Just like you made the analogy from 911, this is another game changer, or a world changer, so to speak, moving forward. So we're all gonna have to reevaluate the way that we do things moving forward. And again, Dr. Cadet, I really do appreciate you taking the time out of your day to assist us at Community Action Now to help support our disaster management initiatives by informing the general public of COVID-19 and how important it is to do the right thing, basically. So thanks again. We do appreciate it. On behalf of Community Action Now, I'm the advisory board chair, and all its members, we do thank you from the bottom of our hearts.
My pleasure.
Thank you very much.
Thank you.
My pleasure. Right. I guess we'll sign off here.
I guess we'll sign off, and I'm here if you need me. I appreciate that.
All right. Take care.
Bye-bye.